one risk factor of pelvic organ prolapse. As a background, that pelvic organ prolapse is one of the public problems generally affecting physical wellness and quality of life millions of women nowadays, and it is related to sexual dysfunction as well as gastrointestinal tract and bladder dysfunction. And from study group of Women's Health Initiative revealed that the POP or pelvic organ prolapse incidence in US reaching up to 41% of women age 50 to 79 years and uterine prolapse take third place from all of those POP, or about 14% from POP. The prevalence of levator ani muscle damage reaches 15 to 60% as the main cause of POP itself on women after vaginal birth. And as we told you that the stem cell therapy became one of promisingly alternative therapy, which is medically capable to solve almost all the degenerative diseases and hopefully will be useful for pelvic organ prolapse itself. As a background, we also try to find the basic or the preliminary study before the bigger study to find the stem cell for the therapy for prolapse of the uterine and other pelvic organs. And we also in this objectives of our study, the aim of the study is to study the expression of muscle stem cells. Is there any difference between the MUSCS of levator ani muscle from middle-aged women compared with those of older age women? And we do realize that this is a very preliminary study, which we work with very short time, and we only found some samples. However, we found this as a new fact that will help us to make a bigger study later. And we also want to find the relative equality between donor and recipient of stem cell therapy, that we don't try to find the great dose of the stem cell therapy. Anyway, we just try to find the reality of the expression of stem cells on the injury of the levator ani muscle itself, and then we will study and study again related to the stem cells of as a therapy right away. And from the literature reviews, we found here from the research in 2021, we found as a background of the stem cells to improve the muscle structure after injury. We discuss about the general injury in other muscles. They are not only in levator ani. However, we found here that how parasite as the most component in the endothelium will find a way to improve the myofiber from the muscle stem cells that's already available between the basal, below the basal lamina itself, and it will make the unity between the myofiber, basal lamina, and endothelium itself back to the previous shape of the muscle. And here is the part of the very important part of the muscle of the pelvic organ supporter. There are so many ligaments, so many muscles, but levator ani is a very important role he, they have a three parts here: puborectalis, insertion of the pubo and the pubo and rectum, and the pubococcygeus and ileococcygeus, and three of them are all the biggest supporter of the pelvic organ above. And here is how the other organs in front of and behind of the uterine also can affect from can have a get down from the pelvic area, from the anterior descent and posterior wall descent, and also central prolapse. Certainly, this is the most morbidity condition which we can find as a uterine prolapse in 4 grades here before the prolapse itself. Sometimes the women feels like discomfort in passing urine or in having sexual intercourse and other activity. They feel discomfort, and this will make our prediction to the uterine prolapse for the older people, especially. Before some changing of the muscles, we know that the inside and in membrane of the cell itself, there are so many complex metabolism that already work uh, from all of the receptors and some enzymes, and includes all of the microRNA. And also we found the muscle stem cells here, like a quiescent satellite cell, activated satellite cells and proliferating myogenic precursor. And they found the here they become a myofiber here, fusion into myofiber. And we also, if we study from other study of the murine, postnatal murine muscle derived stem cells here, we found that they divided the cells into endodermal, mesodermal, and ectodermal, and found here as the most cluster differentiation. We found some markers here that mostly found in the some muscle cells, stem cells itself. And here is the appearance of flow cytometry of normal muscle compared with post-injury muscle, which we found the irregularity of the muscle self. And in this study, it is colored by antibody CD81. Anyway, we found another facts later with another antibody. And this is the fact that we found CD56 plus as a main marker of the myogenic compared with 34 as endothelial for sure. And also we found in other study, we found some fact that from urine we found CD105 and 10 and 90 here. We found from other studies that aging make a cell deterioration, tissue weakness, and finally pelvic organ prolapse itself. The concept of our study here that levator arni muscle injury during vaginal birth collapse with cell aging process in elderly people. make deterioration of muscle stem cells, which we found here that the main markers of muscle stem cells itself, they are CD56 plus, CD90 plus, and CD105 plus, which we studied here. And we found from the deterioration, we found the decreased function of levator muscle itself, decreased function as a pelvic floor supporter, and finally pelvic recurrent prolapse in elderly women. The method of the study, we performed the study we in Brawijaya University General Hospital in the delivery room from the some vaginal births we found from July to September. And this is incidentally collective sampling, which we didn't expect to have a injury or any other rupture from our vaginal delivery. We hope all of our patients deliver safely without any rupture or any injury at all. However, we found it if there's a criteria equal to our inclusion criteria, then we collect the samples, and the women who just underwent vaginal birth with peritoneal tear just more than grade 2, because we know that the levator will appear after grade 2 above, from the perineal tear. And surely they have to sign the agreement letter, and then we perform like a small incision or biopsy to the levator muscles that's clearly seen from the levator after we give some anesthetic infiltration, and then before we perform stitch of the perineal tear, we take a small biopsy about 2 millimeter to 2 millimeters, and we collect it to the formalin fluid. The biopsy sample was sent to Laboratory of Pathology Anatomy, Brawijaya University, in order to perform paraffin blocking, before we slice into slides. We collect it to the pathology anatomy laboratory, and then we brought our slides to the biochemistry, molecular biology lab, and central lab of life sciences for immunofluorescence staining and imaging with confocal microscopy, and then that analyzed with paired t-test analyzed in GRAPAT Prism 941. This is just almost the same previous slide. This is just like a scheme of the study mechanism of our study. We divided to 2 groups, group 1 to 20 to 30 years old, or we suppose this as young group, and another group, group 2, contained with 35 to 45 years old. As we know, this is very difficult because mostly in this age, we found that delivery is getting smooth because the muscles already elastic, and we rarely found the injury in this group actually. So yeah, we will tell you in the last result. The paraffin blocking slicing process performed as we already described before. And for the result, we found only 7 samples. As we told you that we collected this incidentally, so we found only the there were true injury within the perineal. So we found the levator muscles clearly. So we we mention this as our samples. If there is no levator ani injury, we suppose it as not suitable for our sample. That's why we only found this only 7 samples, which is 6 samples from the young age and only 1 sample from old age. However, that's the true that we have to show you. However, the result is that the young age with the CD56 results here, we found there is some differences, however, from the young and mature or old age here. However, there is no significant difference from those 2 groups from the CD56 in the study. So yeah, that's the fact that we have to show you honestly, however, in this result. And from the CD90, we also found that there are different, but the difference is very, very slight, and we found no significant difference between 2 groups in marker CD90, as well as CD105 plus. We also found very slight difference. Maybe some difference found in CD56, but from our analysis, there was no significant from p value. We found no significant result. So from the general result of our study, from immunofluorescence of the CD56, 90 and 105 plus as a marker of muscle stem cells, we found there is difference, but no significant difference from young and old group of levator ani injury group. However, there was no significant difference of muscle stem cell expression from levator ani muscle in middle-aged women compared with those of elderly age women. But basic study of muscle stem cells is in larger sample is very required to confirm the study, because some factors make this collecting sample would become difficult, include some ethical, and maybe there is injury, but no patient will agree to sign the agreement, and etc. So many factors. So the study needs more sampling for sure, but we hope that we found another way, the best way to collect the incidental sampling for next study. And CD56, CD90, and CD105 can perform as myogenic as well as myendothelial stem cells marker in levator ani muscle. And stem cell therapy as an alternative prevention for pelvic organ prolapse may be possibly administered to young women in equal dose to old women as a kind of prevention. Here from our study presentation. Thank you very much for your attention. And this is our activities during the study by confocal microscopy and Brawijaya University. Thank you very much.
Thank you, Dr. Nirmala. That was an excellent presentation.